So I'm standing here at the Judy Dan Wound Care Center in Toronto, where patients are able to come to naturally heal their wounds. Patients are able to pick a movie to watch during their treatment, which can be up to 2 hours.
My name is Dr. Ron Linden. I'm a hyperbaric physician. I run this center, which is the Judy Dan Research and Treatment Center. We treat a number of different patients who have different conditions. Some of them have diabetic ulcers, some have radiation damage, some have bone infections, and we treat the occasional diver who's got decompression sickness. Diabetic wounds are very complicated to treat. They are myriad of different causes of diabetic wounds, but the most serious one is the blockage of the arteries, large, small, and the capillaries, the vessels that bring blood to the tissues. So these tissues are lacking in blood, and not only are they lacking in blood, but they're lacking nutrients, they're lacking oxygen. And these diabetic patients have a problem. They have a lack of oxygen getting to their tissues. If they get a cut on their foot or an injury, the cells that normally would heal the wound or fight any infection will not function without oxygen. So their wounds get worse and worse and worse, and their wounds get infected. And once those wounds start getting deep into the bone or tendons, frequently they result in amputations.
The pressure that the patients are exposed to is equivalent to scuba diver, let's say, or snorkeler going to 33 feet of water. So imagine yourself at sea surface and going down 33 feet. So the pressure at 33 feet is the same as what the patients are exposed to. If you breathe oxygen normally, that oxygen gets only to part of your body. If you are in a compromised situation, like most of our patients are. However, if you are exposed to pressure, that the pressure of the chamber, pressure of the gas, forces oxygen to go all the way to the extremities.
There are only 12 hyperbaric oxygen chamber treatment centers in Ontario, 7 of which are privately owned, 4 are in hospitals, and there's 1 in a military base. For XFM News, I'm Holly Miller.